Students, very good morning to all of you. Today I have to talk to you about communicating people with hearing loss. How to communicate with people who has the hearing impairment, dysfunction in the hearing. Okay. How communication is said to be successful when all the peoples are involved in the conversations. That time communication is said to be successful. In that time, sender sending the message and receiver listening the informations or listening the artifact of the message. Our message is very meaningful. Okay, so that in that conversations the communication is to be successful because your sender sending the message and the message will be meaningful and understandable, and receiver received the message and decoded it, and it will be understandable by the receiver. Okay, so that active listening is required for receiving the message, so that communication is said to be successful. But people who are the hearing loss or impairment the hearing, they cannot be able to the hearing the sounds voice and do not understand the proper words, so that persons require hearing aids for the proper hearing and uses active listening strategy. What are the faces the hearing impaired person directly? During the communications, during the conversations, you faces different problems or different things by the hearing impaired persons, and that can be faces problem directly. You faces various type of situations during the communication of the hearing impaired person directly. So during the during the conversation, so some points are remember for the facing the hearing impaired persons. So first is the don't talk from another room. So when you talk to the hearing impaired persons, you talk directly by face to face, where here maintain the IPR through by eye contact. You can whatever you said, then the hearing impaired persons can easily understand and easily listen or listen in the proper way, and then the speak clearly, slowly, but naturally without shouting. So during the speaking to hearing impaired persons, you should use the clear language by which the visual impaired persons clearly understand. And when you speak certain about certain things, that speech is very slowly, very clearly and understandable, and it is not created sounded, by which listener or visual or the hearing impaired persons can understand better way of your voice, because your voice is very clearly, slowly, and he easily understand. तो hearing impaired person कथा कहला समय very धीरे धीरे कहब, अत्यधिक shouting करबा नै बा पार्टी करबा नै, एवं सेटा बहुत क्लियर से वर्डटा बहुत क्लियर हवा उचित, जा फल कि hearing impaired person कोन हुए ना भल भाव सेटा जिनस बुझी पारिबो, भल भाव पढ़ी भी पारिबो, किसी प्रॉब्लम फेस कर पारिबो नै. ओके, then the say the person's name before beginning a conversations. So before giving some message to the hearing impaired persons, at the time you should first say your name before beginning the conversation, because if you say your names or give introductions, then then the hearing impaired client easily give cooperate to your give cooperate to you, and also listen your voice very promptly and very actively. Okay, in good manner, and here is the reduce the chances of the missing the word. And here the listener begin to focus more attention towards your voice, so that hearing impaired persons more focus your words and also remember your words what you said and cooperate with you. Okay, then avoid talking too rapidly or using sentences that are too complex. So during the conversations or during the communication with hearing impaired persons, at the time you should not to talk very rapidly, because he or she cannot understand your language or voices, and she cannot focus attention towards your words, because you said in rapidly in such a way that he can't understand. So between the sentence, you should talk to the hearing impaired persons very slowly, and through by the sentence given pause, then start another sentence. Suppose I am going to market, then I am going to market and eat the sweets. It is an example of sentence. First you say that I am going to market, then pause into then give pause, then I eat sweet. I will eat sweet. Okay, in that way, between two sentences give a pause, then another sentence will start, and it will be said that sentence very slowly, not too rapidly, because it is cannot understand by the listener or the hearing impaired persons. While taking while talking, keep your hand away from the face. If you when you are eating, chewing, smoking, at the time talking is which will be more difficult to the understand by the hearing impaired persons. Weird moustaches also interfere with the ability of hearing impaired to speech read. Then if during the conversations, if it is happen, then you instead the patient write the message. Okay, so ଯେତେବେଳେ କ'ଣ କରୁଛ ନା ଫାଷ୍ଟ ହେଉଛି କ'ଣ, नेक्स्ट है कम्युनिकेशन आउ गोटे पार्ट हूँ हियरिंग पार्ट सहित जो आम कन्फरेन्स करुचे कीप योर हैंड अवे फ्रॉम योर फेस व्हाइल टॉकिंग व्हेन यू chewing smoking eating at that time, if you give conversations to the hearing impaired persons at that time, your words is not clearly understood by the hearing impaired persons, because your speech is very difficult to understand, because you are in eating, chewing or smoking. If it is happen, give a message, give a message through by the your language, body language, and also we write some message at that time, then the hearing impaired person it is understand in some extent. तो जिते खाऊच जो चोबोच कि स्मोकिंग कला समय कथा कला समय जो हियरिंग इम्पेयर्ड पर्सन जब किसी कन्वर्सेसन करके किसी कहूच ताले से हियरिंग इम्पेयर्ड पर्सन ठीक भाव में बुझीपारे ना कहीं खाइला समय कहुई थाए कि स्मोकिंग कला समय चिंग समय जब किसी कहुई थाए आई कंटाक्ट प्रॉपर मेंटेन हुए ना एवं क्लाइंट कौन करे जो वार्ड कही था से वार्ड को से ठीक भाव बुझीपारे ना से वार्ड रे किसी क्लारिफाई आसे ना तेणु से समय कौन करवा उचित ना किसी मेसेज लिखिदेवा पेसेंट को इंस्टॉल करवा किसी मेसेज तुम लिखिक दियो कि से लिखिदेव कौन से तार प्रोब्लेम रही. ओके, then position yourself. When you if hearing impaired persons is listen in one ear is better than another ear, then try to find out which ear is better for the listening the voice, so that in that ear uses is better way during the conversation. तो position yourself कौन हम ना position yourself रे क्लाइंट रो को हियरटा बेसी लिसनिंग करबा पई बहुत एक्टिव अछि आ गोटे इयर अपेक्षा जदि सेमति पाउछ ताले से इयरटा कथा कहला समय से इयरटा को बेसी जेंति एक्सपोज होबा उचित कहला समय से इयरटा जेंति एक्सपोज होबा से भल भाव शुणी पार जहाँफल कि से निज निजर पोजिशन को बॉडी पोस्चर गेस्चर पोस्चर ठीक बैलेंस मेंटेन कर पारि थाए. Try to minimize external noise when talking. Certain times you see that there are large noises in that surroundings at that time if given speech to the somebody. At that if the person is hearing impaired, if give speech at that time during the loud noises or crowded places, at that time the hearing impaired persons or hearing dysfunction persons cannot understand your voice language, cannot listen the words properly, and cannot clarify your her doubts through by your language. So that be careful. If there is a noises places, then it is avoid to it during the speech. If it is happen, then you will go to the another site and give your instructions and your words and keep speech to the hearing impaired persons. ଯଦି କେଉଁଠି କୋଳାହଳ ବା ନଏଜ୍ ରହୁଛି ତାହେଲେ ସେଇ ଜାଗାକୁ ଆଭଏଡ଼ କରିକି ଅନ୍ୟ ଜାଗାରେ ହିୟରିଂ impaired personକୁ ଭଲ ଭାବରେ କୌଣସି କାମ କୌଣସି ବିଷୟବସ୍ତୁ ଉପରେ ବୁଝେଇବା ବା ତାର ପ୍ରୋବ୍ଲେମକୁ ସର୍ଟ ଆଉଟ୍ କରିକି ତାକୁ ବୁଝେଇବା, ଯାହାଫଳରେ କି ସେ ପ୍ରପର ଭାବରେ ବୁଝିପାରିବ ଏବଂ ସେ ଶୁଣି ବି ପାରିବ। ଓକେ, avoid situation where there will be loud sound when possible. So some people with hearing loss are very sensitive to loud sounds, so that loud sound will be easy gives the non-tolerance to the hearing impaired persons, so that avoid the loud noises, avoid the situations. Then speech in the another speech the problem speech about anything in the next time or on another room. Okay, next try to find a different way of saying the same things. When you said some sentence which is difficult to understand by the hearing impaired persons, so that you again and again repeatedly tell to that sentence to the hearing impaired persons in different way by the giving message by your body postures and languages. Through by a different way you should shows your expressions by which hearing impaired persons can better understand your language which is you have to taught. So it is very better, but always try to say same thing to the hearing impaired persons in different way. Suppose you have to you want to give some fruit juice, so that in this sentence you also be give speech to the hearing impaired persons like that you take fruit juice. If it is unable to understand, then you take a drink glass of the fruit juice and will be placed in the table, and then express and then the give your expressions through by your palm how to take drink by the expressions. You should take your palm towards the mouth, so that by that expressions the hearing impaired persons is better understand. Then he take the fruit juice, then drink it. But do not tell that word repeatedly. Take fruit juice, that do not take do not say repeatedly the same sentence. So you said same sentence in different way, that means by through the expressions. Already I have given example. So ଯେତେବେଳେ hearing impaired ଯେତେବେଳେ ଯେକୌଣସି ଜିନିଷ କହୁଛ ତାକୁ ସେଇ ଜିନିଷକୁ ଡିଫରେଣ୍ଟ ୱେରେ କହିବା, କିନ୍ତୁ ବାରମ୍ବାର ସେଇଟାକୁ ରିପିଟ୍ କରିବନି। ଏକ୍ଜାମ୍ପଲ୍ ଗୋଟେ ଦେଉଛି, ତ ତାକୁ କହିବା ଗ୍ଲାସ୍ ଅଫ୍ ଫ୍ରୁଟ୍ ଜୁସ୍ ନେ। ସେ ଯଦି ବୁଝିପାରିଲାନି ତାହେଲେ ତାକୁ ଟେବୁଲ୍ ଉପରେ ରଖିଦେବା, ଏକ୍ସପ୍ରେସନ୍ କରିବା କ'ଣ, ପାମ୍ଟା ହାତଟାକୁ ନେଇକି ପାଟି ଆଡ଼କୁ ନେବା, ସେ ଗ୍ଲାସ୍ର ଯେମିତି ଧରନ୍ତି ସେଇ ଟାଇପ୍ର ଆମେ ଧରିଲା ଭଳିଆ ଆକୃତି କରିକି ପାପୁଲିକୁ ବା ଫିଙ୍ଗରକୁ ଆମେ ପାଟିକୁ ନେଇଯିବା। ତାପରେ ସେ କ'ଣ କଲା, ସେ ଏକ୍ସପ୍ରେସନ୍ ଦେଖି ସେ ବୁଝିପାରିଲା ଯେ ଫ୍ରୁଟ୍ ଜୁସ୍ ନେବାକୁ ସେ କହୁଛନ୍ତି, ଫ୍ରୁଟ୍ ଜୁସ୍ ନେଇଯାଏ। କିନ୍ତୁ ସେ ଯଦି ବୁଝିପାରୁନି ତାହେଲେ ସେ ଫ୍ରୁଟ୍ ଜୁସ୍କୁ ବାରମ୍ବାର ଟେକ୍ ଫ୍ରୁଟ୍ ଜୁସ୍ ବାରମ୍ବାର କହିବାନି, କାରଣ ଏହା କହିଲେ ସେ ଇରିଟେସନ୍ ହେଇଯାଇଥାଏ। ଓକେ, if it is specific, if hearing impaired person cannot understand specific information such as the time, place and phone numbers, then it will be said again and again So repeat the specific back to you. Many number of words sound alike. Okay. Provide pertinent information writing. Whenever the informations or the any sentence cannot understand clearly, the hearing impaired persons cannot understand the clearly whatever the information is provided, then that information is given through by the writing, through by the messages, through by the work assignment. That information should be provided. Then come to the assessment of self-help ability. So what is self-help ability? That means you perform your work daily. Example like toileting, grooming, dressing, cooking, eating. That is known as self-care ability. Every persons do their perform their ability in daily. When you wake in the morning, then you go to the toilet, brushing the teeth, then take the breakfast, then go to the school, then adult person go to the services, and go to joining in the business places, or participate in the business, and then come to the home in the 7 o'clock, then will be take the dinner, then the rest. So this is a one day daily activities where every person can do. That is the self-care ability of the persons. In here the persons maintains in various way to keep the health and neat healthy, and keep the neat and clean to the body by the grooming, by the eating. सो केमती हम हेल्थी प्रत्येक नीतिदिन आम जहाँ कहे ताको आम सेल्फ केयर एबिलिटी कहूचे आमर निजे कौन कर टॉयलेटिंग जावा ब्रश करवा गाधेवा कॉलेज जावा बिजनेस क्षेत्र को सर्विस थ्रू जावा रूम फेरवा डिनर करवा तेणु खाଇବା पिंधिबा ये सब हूँ पर्सनल हाइजीन भितर जाऊँगी पर्सनल हाइजीन भितर आम बॉडी को नीट एंड क्लीन करवा दांत घषा ये सब पर्सनल माउथ को मत केयर दौचे माउथ किसी ब्रश करी सका माउथ और टीथ केयर नौचे बाथिंग करी स्किन मत केयर नौचे ओके एवं खाद्य खाई आम बॉडी को ठीक रे हेल्थी कंडीशन रखुचे ताहले यह हूँ आम सेल्फ केयर एबिलिटी कहले कौन ना निजे निजे आमर केमती आमर एक्टिविटी करुचे नीतिदिन जीवन में we perform daily activities daily okay like toileting, grooming, eating. These are the and dressing and wearing the dress. That is the self care ability of persons. So what are the self care activities in daily living? Like the eating, so it is the ability to taking the food through mouth. It is known as eating. And the self care in self care activities, grooming is also included. In grooming, in grooming you give care to the hair, nails. Okay, we cut the shortly, we cut the nails, or we can keep the hair very shining. Okay, and also we are the eyewear, applying various type of facial cream to keeping the good face. And also use makeup and shaving also done for the male persons to keep the face very clearly, and brushing the teeth to prevent the bad to prevent the infections arises in the root of the teeth. And also given the denture care is also be who are uses the artificial teeth. Okay, next bathing. In the bathing you use the sponge bath, shower bath, tube bath, etc. according the patient and which type patient according to it you given the bath. And it is include the ability of a persons to wash upper and lower extremities and hair also. Dressing upper body that is above the waist you wear the garments. And also uses prosthetic and orthotic devices, compression garments. In the prosthetic device uses the devices that also designed to the replacing the missing part of the body or to make a part of the body work better. ताले prosthetic device कौन करा जाए ड्रेसिंग अपर बॉडी रे आमे कौन करूचे एथरे इनक्लूड कौन रहउची ना वेस्ट ऊपर को आमे कौन करबा गारमेंट पिंधि थाउ वेस्ट ऊपर क्लांट कौन करे गारमेंट पिंधि थाए एवं एथरे मध्य वेस्ट ऊपर वेरियस टाइप प्रोस्थेटिक डिवाइस यूज करा जाय थाए जेतले कौन बॉडी रो कौन पार्ट मिस हेला परे प्रोस्थेटिक डिवाइस से जगह रे प्रोस्थेटिक डिवाइस से जगह अप्लाई करा जाए एवं व्यक्ति नॉर्मल वर्क बेटर करिथाए. Okay, so prosthetic device is a devices that is designed to replace the missing part of the body where the persons that part work better. से part body से part भल काम करिथाए. So when a disease or a missing eye, arm, hands, legs or joints are commonly replaced by the prosthetic devices. Example, false teeth are known as dental prosthesis. When there is no teeth and teeth decay occurs, so that we remove the teeth. So instead of that teeth we use the dentures or the false teeth or artificial teeth. So that is a example of dental prosthesis. So जेतला हम दांत रे इन्फेक्शन होची हम से दांत को कोन करूचे ना रिमूव कर दोचे ता जगह गोटे आर्टिफिशियल टीथ लगोचे बा फॉल्स टीथ लगोचे या मध्ये एक प्रोस्थेटिक डेंटल याकू डेंटल प्रोस्थेसिस कहंती. यह एक प्रोस्थेसिस रो एग्जांपल अटे. Next come to the dressing of the lower body. So it is including the donning the garments below the waist. तो waist रे तळको हमें कोन कहछो गारमेंट पिन थाउ. अब क्लांट कोन करे waist तळको गारमेंट विनोग्रा गारमेंट वेयर करथाय. एथर मध्ये प्रोस्थेटिक डिवाइस जाउची ऑर्थोटिक डिवाइस मध्ये रहउची. तो एथर क्लांट रो ड्रेसिंग अपर बॉडी रे क्लांट रो वेस्ट ऊपर भाग रे आमे वेस्ट ऊपर भाग रे प्रोस्थेटिक ऑर्थोटिक डिवाइस यूज करिथाउ एवं लोअर बॉडी वेस्ट तळको मध्ये विभिन्न प्रकार प्रोस्थेटिक डिवाइस ऑर्थोटिक डिवाइस. प्रोस्थेटिक डिवाइस रे कोन हला दैट इज डिवाइस यूज्ड टू रिप्लेस द मिसिंग पार्ट ऑफ द बॉडी वेयर दैट बॉडी पार्ट वर्क बेटर. ताले बॉडी रे जे कोनस पार्ट रे कौनसी पार्ट जब मिस कौनसी पार्ट जब मिस हो गला से जगह कौन है प्रोस्थेटिक डिवाइस अप्लाई करि थाउ. जदि हम आई आर्म हैंड लेग्स जो जॉइंट्स रे मते जदि किछि मिस पार्ट हला ताहले से जगह प्रोस्थेटिक डिवाइस यूज करा जाय थाए. एग्जांपल होची आर्टिफिशियल टीथ और द फॉल्स टीथ आर यूज्ड इंस्टेड ऑफ द actual teeth because of the infection that is removed. तो जो टीथ इन्फेक्शन ताको रिमूव करा जाय ता जगह फॉल्स टीथ यूज करा जाय. फॉल्स टीथ होचे एक एग्जांपल ऑफ डेंटल प्रोस्थेसिस. डेंटल प्रोस्थेसिस एग्जांपल है फॉल्स टीथ. सिंध ऑर्थोटिक इज दीज आर सॉफ्ट. इट इज यूज्ड टू द करेक्ट द मूवेबल पार्ट ऑफ द बॉडी. बॉडी जो मूवेबल पार्ट रही तार फंक्शन को करेक्ट करने पई ऑर्थोटिक डिवाइस गुडा को अप्लाई करि थाउ. ऑर्थोटिक डिवाइस गुडा को गोटे टाइप रे सपोर्ट अटंती एवं एमाने कोन करंती ना जो मूवेबल पार्ट बॉडी जो मूवेबल पार्ट रे फंक्शन ठीक नै से पार्ट को सपोर्ट दे थांती. एग्जांपल शू इंसर्ट ऑर्थोटिक्स दैट आर इंटरनेट टू करेक्ट द एब्नॉर्मल इरेगुलर वर्किंग. हम गोटे एग्जांपल दबा शू इंसर्ट्स आर ऑर्थोटिक्स. एते शू ऑर्थोटिक्स यूज करा जाय थाए जेतले कौन सी आम ठीक रे चली पार न थाउ कि ठीक रे काम करि पार न थाउ. ओके, सेतले शू ऑर्थोटिक्स आर यूज करिकि कोन करे थाउ आम गोड़र वर्किंगटा ठीक भाव होता है. जेतले आम ठीक भाव चली पार न थाउ सेतले शू ऑर्थोटिक्स यूज करा जाय थाए. ए शू ऑर्थोटिक्स द्वारा कौन हुए ना व्यक्ति ठीक भाव चली पारि थाए हला. ये केमी संभव हुए या कौन करे शू ऑर्थोटिक्स यूज कला परे गोड़र एंगलटा को स्लाइटली कौन करे चेंज एंगलटा को जो टाइप रे से एंगल धीरे धीरे चेंज हो जाए एवं व्यक्ति ठीक भाव में चलवा को स्टार्ट करे. सो शू ऑर्थोटिक्स आर वन टाइप ऑफ एग्जांपल बाय व्हिच इंडिविजुअल्स walk through by the foot. Then come to the toileting. It is a ability of an individual to do the toilet. So for the when he feels to remove the stools or pass away the stools or for the urinations they go to the toilet. And when he sit up the commode and go to toilet and sit in the commode or the bedpan, that is a commode also include bedpan urinal. Through by the it is maintain the hygienic. तो टॉयलेटिंग कौन हो ना व्यक्तिर एबिलिटी हूँ जे से टॉयलेट के जीव यूरिनेशन कर स्टूल पास वे करए एथेर से कौन कमोड उपर बसी कि अनअफ कमोड उपर बसी थाए कमोड्रे बेड पैन बा यूरिनल दुटा को करि पारिथाय एहा हाइजीन मेंटेन करिबारे सहायता करे. Then the come to the personal hygiene. Personal hygiene means it includes the both bathing, toileting, body hygiene, grooming, etc. So individuals waking in the morning and involved in the morning care. So here the person go to toileting, then brushing, then they take the breakfast. So then in the afternoon also afternoon care is will involve in the afternoon care, like the taking the lunch, okay, and then the hand also be uh, hand washing done before and after taking the meal. Then he takes sleep. Then the all type of care are provided according to the need of the client. Then to come to the communication methods and special consideration. So first is the communication. What is the communication? So exchange of informations or feelings between two people is known as a communication. So in the communications is a method of transferring the informations between two peoples, and which is the understandable by the listener, which is sent by the sender. The sender द्वारा जो मेसेज पठा जाइए से मेसेज अंडरस्टांडेबल होगा उचित, जोटा कि रिसीवर रिसीव करि थाए. एवं कम्युनिकेशन होची प्रोसेस जो थरे कि इनफॉरमेशनटी दुटी लोक मध्य एक्सचेंज होता है. So there has a different type of skills are used in the effective communication, like the attending skill, rapport skill, empathy skill, confidence, analytical, open-mindedness, active listening, honest, and etc. So in the attending skills is a method of effective communication where the peoples are actively attend during the provided the informations during the sending the informations. इनफॉरमेशन सेंडिंग समय समस्त लोक से प्रेजेंट रहा दरकार से सिचुएशन में. देन द रैपर्ड स्किल्स. इन द रैपर्ड स्किल्स दैट रिलेशनशिप्स इज इन दैट रिलेशनशिप two persons maintain the IPR interperson relationships, and it is very useful both the persons, and it keep peaceful between two peoples, and where it maintain the harmonious between two peoples. Next come to the empathy skills. Empathy, in the empathy skills, here nurse or the caregiver should be properly identify and understand the client's emotions. So here the nurse and caregiver has the ability to understand client's emotions, client's feelings. Sympathy skill कौन हुए ना नर्स किंबा caregiver रो ability रहा उचित जे client रो इमोशन को भल भाव चिन्ह पारिबा एवं बुझी पारिबा उचित. तो client रो इमोशन को नर्स एवं caregiver भल भाव बुझिबा एवं भल भाव बुझिबा एवं भल भाव चिन्हिबा उचित. So here the nurses and caregivers should be able to understand about the client's feeling and perceive about the client's feeling, and according to it nurse and caregiver should provide to the help the client. Then comes the confidence. So maintaining a trust between the two people, here make a confidence by which trust will be developed between two peoples. So here nurse will be confident by which he provide the knowledge to the client, and through by the skillful action they complete their task and perform their good procedures. So here in the confidence, it develop a trust between the two peoples, sender and the receivers, and the sender as well as the client, by which here the nurse also be makes self confidence, and he uses the knowledge perfectly, and it share the knowledge to the client, and also do the skillful action to complete that task. Through the confidence, the procedures as well as the care receiving system is better for the client, okay, and by which the client cooperate with the caregiver for receiving the procedures. Then comes the analytical. So after the message will be transferred to the listener area, then listener that message will be listened, that information will be listened by the recipient, and message will be understand. When message will understand, so that it is said that proper communications. So analytical means ability to examine the impact of message on the listener or recipient for effective communications. So analytical रे कौन होची ना आम एग्जामिन करिबा जे जो मेसेज आसिला ताहा रेसिपिएंट और लिसनर ऊपर केते अफेक्ट पकोछ एवं से सेटा बुझी पाछु कि नाही, तो इफेक्टिव कम्युनिकेशन हैला कि नाही ताको एनालिटिकल स्टेज रे इंक्लूड करा गला. इन द ओपन माइंडनेस, when the communications here communication will be explored when the information entering into the situation. ଯେତେବେଳେ କୌଣସି ବ୍ୟକ୍ତି ପ୍ରୋବ୍ଲେମ୍ କିଛି ଫେସ୍ କଲା, ସେହି ସମୟରେ ଯେଉଁ ଇନଫର୍ମେସନ୍ ଆସିଲା ତାକୁ ସେ ଇନଫର୍ମେସନ୍କୁ ଏକ୍ସପ୍ଲୋର୍ କରାଗଲା ଏବଂ ବିଭିନ୍ନ ଲୋକଙ୍କ ସହିତ ଡିସ୍କସନ୍ କରାଗଲା, ତାପରେ ସଲ୍ୟୁସନ୍ ପାଇଲା ପରେ ସିଚୁଏସନ୍କୁ ହ୍ୟାଣ୍ଡଲ୍ କରି ହେଲା. ତ ଏହା କୁହନ୍ତି ଓପନ୍ ମାଇଣ୍ଡନେସ୍. ସୋ ଇନ୍ ଦ ଓପନ୍ ମାଇଣ୍ଡନେସ୍ ହ୍ୱାଟ୍ ହ୍ୟାପେନ୍ after entering into the situations, what are the problems come out, then that will be explored, that decided by the authority to the lower employee by through proper channel. Then the informations will be known by all the people, then decision comes, then task will be completed and they solve the situations. So it is not the open mindedness. When a hearing impaired persons faces the situations, faces the problems to understand about the voices and sentences, so that difficult, when that difficult will be exposed by all the healthcare team members, then they will decided to what are the problems, then find the solutions, then it will apply, then the solve the problem. Then come to the active listening. In the active listening, it is a good quality of communication. Here when the persons listen the informations, the hearing impaired persons receive the informations, after that he said that yes, and bowing their head, and also maintaining the eye contact with you, and always saying yes or no in between the conversation. So जो व्यक्ति ठीक रे शुणुची ताको हम जानबे से yes no मझरे कहूची. जदि हियरिंग इम्पेयर्ड पर्सन्स किछि इनफॉरमेशन शुणु थाए, जदि से भल रे शुनि पाले बुझि पाले तने yes करे, नाइदर नो करि थाए सेंटेंस भितरे. Honest also very important in the communications. It include the formal, informal and the interpersonal. So formal communication occurs when the flow of official information through the proper channel. Okay. So it कौन हुए कम्युनिकेशन टाक जो हनेस्ट कह जाए ना, जिते कम्युनिकेशन फॉर्माल अटे, जिते इनफॉरमेशन गोटे प्रॉपर चैनल चली थाए, एवं यह इनफॉर्मल अटे बा नॉन फॉर्मल कम्युनिकेशन अटे जेतले स्पोकन रिटन द्वारा टास्क कंप्लीट हैलानी टास्क सॉल्व हैलानी तेणु ताहा गेस्चर बॉडी लैंग्वेज द्वारा कन्वे करा जाए बा एक्सप्रेशन दे कौन हुए ना इनफॉरमेशन को ठीक भाव में बुझेबा को क्लांट को इनफॉरमेशन दि जाए एवं क्लांट जपर बुझीपारि से ध्यान दि जाए ताले एथरे जानले जे फॉर्मल कम्युनिकेशन इज द फ्लो ऑफ ऑफिशियल इनफॉरमेशन थ्रू द प्रॉपर चैनल एंड द नॉन फॉर्मल इनफॉर्मल कम्युनिकेशन इट कैन बी स्पोकन रिटेन और इवन कन्वेड थ्रू ए गेस्चर एंड बॉडी लैंग्वेज तो नॉन फॉर्मल कम्युनिकेशन रे आम कही था कि किसी मेसेज लिखि था कि गेस्चर बॉडी लैंग्वेज द्वारा इनफॉरमेशन टाको कन्वे करि था ताले नॉन फॉर्मल कम्युनिकेशन इट इंक्लूड द transfer of information through by the spoken written and through by the gesture and body language. Okay, then come to the confidentiality. In the confidentiality it is also important skill and this is used to secret by the nurse and it is always used for particular purpose. Always the nurse always maintain confidentiality of the client because it is the better help for the recovering the illness. The knowledge, everybody has a certain knowledge but the professional knowledge is different from than others. So in the professional knowledge is acquired by the nurse by which nurse gain the various type of procedures known about the various type procedures about the remove the sign and symptoms and apply that procedural skill at any time at any situation whenever required so that through by the knowledge he apply the he uses the communication pattern so that effective communication done because what are the procedure you have to done. So before doing the procedure you explain the procedure details in front of the client, then it is in the confidence of the client, then client cooperate with the us for receiving the procedures. ताले नॉलेज हो गोटे प्रोफेशनल स्किल गोटे इंपोर्टेंट पार्ट एथरे नर्स नॉलेज स्किल प्रोफेशनल नॉलेज स्किल रही जो थे से वेरियस टाइप प्रोसीजर अप्लाई करता है ये प्रोसीजर से कौन करे ये प्रोसीजर द्वारा कौन हुए ना व्यक्तिर कॉन्फिडेंस को भीतर कॉन्फिडेंस को क्लांटर कॉन्फिडेंस को आनी थाए जहाँफल कि से क्लांट कौन करे ना प्रोसीजर जहाँ भी नर्स करती से प्रोसीजर को सहित कोऑपरेट करते सिस्टमैटिक. सो ऑल द कम्युनिकेशन शुड बी डन इन द सिस्टमैटिक वे और ऑर्गेनाइज्ड वे okay by which any problem cannot arise at any time. Then come the tactfulness. In the tactfulness it is a partial quality for effective communication. So here you determine how to message will conveyed and getting response by the client. So it is a very essential quality of a good communication. Then come to the special considerations. Special concept of the pediatric communication is special. So when you communicate with the child, here uses verbal non-verbal electronic communication. Okay, so for the pediatric persons use toys, different type of toys and different colors of toys, and we show the pictures with different type of diagram take representation for greater communication children. तो छुआ मान सहित जो आम कौन करें कम्युनिकेशन करचे से आम टॉयज यूज कर वेराइटी टाइप्स कलर्स डिफरेंट बाय पिक्चर्स और डायग्राम रिप्रेजेंटेशन यूज कर. ओके, देन कम्युनिकेटिंग विथ ओल्ड एज पीपल्स. First answer that what type of environment they are for the communicating with the old age peoples. So during the speech with the older people in front of both of you, first there you should speak very clearly and also be tone voice, and between the sentence use the pause, make your eye contact, and use the precise questions, and avoid the noises, avoid the confusion, and avoid the confusion of the mixed idea. Example is given also. ତ ଯେତେବେଳେ ଆମେ ଗୋଟେ ଓଲ୍ଡ ଏଜ୍ ପିପୁଲ୍ ସହିତ କଥାବାର୍ତ୍ତା କରୁଛେ, ଆମେ କ୍ଲିଅରଲି ଭେରି ସ୍ଲୋଲି ଭଏସ୍ରେ ଏବଂ ସେଣ୍ଟେନ୍ସ ମଧ୍ୟରେ କିଛି ପଜ୍ ଦେଇକି ଓଲ୍ଡ ଏଜ୍ ପିପୁଲ୍ ସହିତ କଥା ଇନଫର୍ମେସନ୍ ଗୁଡ଼ାକୁ ସେୟାର କରି ନେଇଥାଉ ଏବଂ ଓକେ, ଏବଂ ଏଥିରେ କିଛି କନଫ୍ୟୁଜନ୍ ମିକ୍ସ ଆଇଡ଼ିଆ ନଥିବା ଉଚିତ. ଏକ୍ଜାମ୍ପଲ୍ ଇଜ୍ ଗିଭେନ୍. I am simple. I have said that it is a water bottle. It is water bottle, and that water bottle is yours. It is water bottle, and that water bottle is yours. You cannot say that type by using two sentence. You simply speak that this bottle is yours. ସାଧାରଣତଃ ଆମେ କହୁଛେ ଏଇ ବୋଟଲଟା ଥୁଆ ହେଇଛି ଏବଂ ଏଇ ବୋଟଲଟା ହେଉଛି ତୁମର. ଏମିତି ନ କହିକି ଆମେ କହିବା ଯେ ଯେଉଁ ବୋତଲ ଥୁଆ ହେଇଛି ସେଇଟା ହେଉଛି ତୁମ ବୋଟଲ. ତ ସିମ୍ପଲ୍ସ ଗୋଟେ ସେଣ୍ଟେନ୍ସରେ କହିଲେ ସରିଲା. ଦୁଇଟା ସେଣ୍ଟେନ୍ସ ୟୁଜ୍ କରେ, ଦୁଇଟା ସେଣ୍ଟେନ୍ସ ୟୁଜ୍ କରିବାନି କାରଣ ଏଠାରେ ଆଇଡ଼ିଆଟା ମିସ୍ ହେଇଯାଉଛି. ଓକେ, ଦେନ୍ କମ୍ ଟୁ ଦ employ visual aids possible. So if you hear older people has the hearing impaired or the visual impaired, so that older people uses the visual aids like the glasses, and hearing aids also use the hearing aids, and for the speech also uses different type of aids. तो जो मैंने देखिपार साधारणतः विजुअल एड्स आम यूज करता ग्लासेस यूज करता एवं जदि से व्यक्ति लोकोमोटर डिजेबिलिटी होता है बा से चली बुली न पाता है ताले आम ताको आशाबाड़ी भाया डिफरेंट टाइप एड्स दे था लोकोमोटर एड्स फॉर द लोकोमोटर डिजेबिलिटी पर्सन्स. यदि हियरिंग पैड पर्सन था आम हियरिंग एड्स देकी श्रवण जंत्र जोटा कहे ताको देकी से शुणी भल भाव शुणी पारि थाए. Then come to the communicating with the client having visual, hearing and speech deficiency. ताले जो व्यक्ति मानकर visual, hearing, speech deficiency रही तांको सहित आम केमिति कम्युनिकेशन करिबा. So before entering the room of the clients, always express your name, give your introductions before the in front of the client, because through by the name the hearing impaired persons or visual impaired persons make proper contact with you and make confidence within herself, then he easily receive the procedures and avoid that confusions between both of you. So you should stay in the client's field of vision if the client has the partial vision loss, and always speak clearly and pleasant tone by which the visual impaired persons clearly understand that word and cooperate to your information and as well as the procedures. So always explain in front of the visual impaired persons whatever you do, and also you touch before doing the procedure you touch the persons, visual impaired persons, by which visual person will confirm that person is present in front of you and he carry the procedures. ताले जितले विजुअल डेफिशिएंट पर्सन अब इंडिविजुअल रोचंदी तांको रूम को एंट्री करिया पूर्व तम ना कहबा उचित. ना कहले कोन होय ना तांकर एक कॉन्फिडेंस क्रिएट होय जे से तांकर इंट्रोडक्शन ना सहित भीतर एंट्री कले तांको टच करिकी आमे सब जिंस कहले और टच करबा द्वारा कोन होय ना से जानि परिबे एवं से माने मन भीतर कन्फ्यूज क्लियर हो जिवो जे जानि पाछे कि व्यक्ति अछंती जे कि हमको किछ कहबा को आछंती. ओके, सो जिते जो प्रोसीजर एक्सप्लेन करूच तांको पर्सन टच करने पूर्व से प्रोसीजर को एक्सप्लेन करवा उचित जहाँफल कि से प्रोसीजर विषय जानवे एवं तुम कोऑपरेट करेंगे. तो तो कौ टाइप साउंड इनपुट आगे डिस्क्राइब कले साउंड सहित जो एंजाइटी फील कर ओरी फील ओरी जाऊँगी से अवॉइड करेंगे। ऑलवेज स्पीक विथ द प्लीजेंट टोन that is makes peaceful to the client. Okay, then hearing deficit persons, in the same things when before entering the room you enter the room by saying your name. Okay, and if there is a noises that will be avoided, and decrease the background noise before speaking for the clearly understand. If there during the speaking you do not speech through by the shouting voice, because it causes the irritation to the client, so that you said through by the pleasant tone. Which ear is the better for hearing? If he is present, you said different type of information in front of the active listening ear area. जो ईयर से भल भाव शुणी पारे से ईयर पटे आम सब इनफर्मेशन सेयार करवा उचित, कारण से भल भाव बुझीपारि थाए जो कहवा से लाउड नॉइज बा साउंड नॉइज करवा नहीं। व्हेन यू ईटिंग chewing smoking at the time, you cannot talk with the hearing impaired persons, because your word becomes your word is cannot gives proper understand to the hearing impaired persons. Hearing impaired person cannot understand your language. तो जिते किसी खाऊचे बा चोबाऊचे से आम कि कहवा ना एवं पार्टी हाथ द्वारा कभर करदे, कहीं जदि आम कहूचे से वर्ड से ठीक भाव बुझीपारे ना एवं से ओरी हो जाए, हियरिंग इम्पेयर्ड पर्सन ओरी हो जाती। During the you are giving your voices, that voices kept at the same level, not up down, because some points will be heard and some points will be negotiated, so that when uses voices, that voices will have the same level, and that should be speaks in the same interval, and speech given is to the hearing impaired persons as very clearly and accurately as possible. Use short phrase rather than the long phrase. If the uses long phrase, uses long phrase rather than the short phrase. The long phrase also is very better understand to the hearing impaired persons. Example, long phrase like the would you like a drink of water? When you give information to the hearing impaired persons like would you like a drink of water, instead of it you say that would you like a drink. So you said that you would like a drink of water rather than the would you like a drink, because would you like a drink of water, it is this sentence is properly understand rather than the would you like a drink. देख प्रथम सेंटेंस रे किसी पीवा पानी पीवा को इच्छा करुछ कि यही भाव क्वेश्चन आम पचारे, सेकेंड रे आम पचारे पीवाई चाहूँ कि ताले जो पीवाई चाहे यही वर्डटा बहुत डिफिकल्ट अटे, कहीं कौन पीवा को चाहे को कौन पीवा को दवा को तुम कहूच हियरिंग इम्पेयर्ड पर्सन को हियरिंग इम्पेयर्ड पर्सन ठीक रे बुझीपारे ना, किंतु जदि कह तुम पानी पीवा को चाहूच कि तो पानी है एथेर गोटे भल वर्ड जोटा कि से भल भाव बुझीपारि थाए। ताले हियरिंग इम्पेयर्ड पर्सन्स better understand that would you like a drink of water rather than the would you like a drink. So uses pronouns is very clear, and every name of the word have the good pronouns which is better understand to the hearing impaired persons. Then come to the speech deficit. It is very difficult to communicate with the people who are the speech deficit. sometimes you, you do not understand about that individual whatever they say. So at that time you said that individuals to say the repeated whatever they said and then repeat again and again. ଯେତେବେଳେ ହିୟରିଂ ଯେତେବେଳେ ସ୍ପିଚ୍ ଡେଫିସିଟ୍ ପର୍ସନ୍ ସହିତ କଥା ହେଉଛେ ଯଦି କିଛି ସ୍ପିଚ୍ ଡେଫିସିଟ୍ ପର୍ସନ୍ ଯଦି କିଛି କହୁଛି ଆମକୁ ଶୁଭା ଯାଉନି ତାକୁ ବାରମ୍ବାର କହିବା ଯେ ସେଇ ୱାର୍ଡ଼କୁ ବା ସେଣ୍ଟେନ୍ସକୁ ରିପିଟ୍ ବାରମ୍ବାର କହିବା ପାଇଁ ଯାହାଫଳରେ କି ଆମେ ଠିକ୍ ଭାବରେ ବୁଝିଥାଉ। So at that time take patience, take much time for the communications, and try to ask questions which require only short answers or nod of the head. ଯେତେବେଳେ କୌଣସି କ୍ୱେଶ୍ଚିନ୍ ଯେତେବେଳେ କୌଣସି କ୍ୱେଶ୍ଚିନ୍ ପଚରା ଯାଉଛି ସର୍ଟ କ୍ୱେଶ୍ଚିନ୍ ଯେତେବେଳେ କିଛି ପଚରା ଯାଉଛି ଯଦି ଜାଣିଛେ ତାହେଲେ ହେଡ଼କୁ ମୁଣ୍ଡ ହଲାଇବା ଉଚିତ। ତେଣୁ ଆମେ ହିୟରିଂ ଇମ୍ପେୟାର୍ଡ ପର୍ସନ୍କୁ ଇନଷ୍ଟ୍ରକ୍ସନ୍ ଦେବା ଯଦି କୌଣସି କ୍ୱେଶ୍ଚିନ୍ ସେ ଯଦି କିଛି କହିପାରୁନି ଠିକ୍ରେ ଯଦି ଆମେ କୌଣସି କ୍ୱେଶ୍ଚିନ୍ ତାକୁ ନର୍ସ କୌଣସି କ୍ୱେଶ୍ଚିନ୍ ତାକୁ ପଚାରିଲେ ତାହେଲେ ସେ ଜାଣିଛି କି ନାହିଁ ମୁଣ୍ଡ ହଲାଇବା ଦ୍ୱାରା ଜାଣି ହୋଇଥାଏ। ଯଦି ୟେସ୍ କି ନୋ, if yes then bow down their head, if no then he moved their head from right to left or left to right. Gives concentration whatever the individual saying. Okay, here speech deficient person कौन कहूँ से तार वर्ड व लैंग्वेज को concentration दबा। Okay, if you cannot understand the speech deficient person's voices or language, so you always said to the hearing impaired persons, say repeatedly of the same sentence by which you clearly understand that languages. So you are difficult to understand the language of the speech deficit persons. You said that speech deficit persons write a message whatever want to the give information to the another persons. ତାହେଲେ ମେସେଜ ଯଦି କିଛି ସେ ତାର ଲାଙ୍ଗୁଏଜ କିଛି ବୁଝି ହେଉନାହିଁ, ଯଦି ହିୟରିଂ ଇମ୍ପେୟାର୍ଡ ପର୍ସନର ସେଟା ସ୍ପିଚ୍ ଡେଫିସିଟ୍ ପର୍ସନର କିଛି ଲାଙ୍ଗୁଏଜ ବୁଝି ହେଉନାହିଁ ତାହେଲେ ତାକୁ କହିବା ଯେ କିଛି ମେସେଜ ଲେଖିକି ଦିଏ ଯାହାଫଳରେ କି ବୁଝି ହେବ ଏବଂ ତାର ପ୍ରୋବ୍ଲେମକୁ ସର୍ଟ ଆଉଟ୍ କରିକି ସଲ୍ଭ କରାଯାଇଥାଏ। Then come to the mobility. So in the mobility, so under the mobility, what is the physically challenged? The person who is said to be the physically challenged, whose function is deviated from the normal health status, that included the physically, mentally, socially and the special care treatment and educations. तो जो व्यक्ति माने तांकर हेल्थ स्टेटसटा नॉर्मल हेल्थ स्टेटस रु डेविएटेड हो सारी ता फिजिकली हो कि मेंटली हो सोशली हो तार सोशली हो तांकर स्पेशल केयर ऊपर से सोशली हो कि स्पेशल केयर ऊपर हो ट्रिटमेंट हो कि एजुकेशन हो ठीक भाव एजुकेशन पढ़ी ठीक भाव एजुकेशन नहीं पारती नहीं तांकर ठीक भाव ट्रिटमेंट से नहीं पार ट्रिटमेंट तांकर ठीक नि जाए न थाए से निजर केयर ठीक भाव नहीं पारती नहीं से माने फिजिकली मेंटली सोशली ठीक नुहंती ता से व्यक्ति मानक आम हैंडिकैप्ड कहते से व्यक्ति मानक फिजिकल चैलेंज्ड कहूचे द फिजिकली चैलेंज्ड पर्सन्स cannot take care herself or himself and also the treatment cannot provide to them and they cannot take educations, so he cannot good in her the physically mentally and socially in physically mentally socially ठीक न थांदी से निजर केयर नहीं पारती नहीं ट्रिटमेंट ठीक भाव दि जाए पारे नहीं से ठीक भाव एजुकेशन नहीं पारती नहीं एवं से फिजिकली मेंटली सोशली ठीक फिजिकली भाव ठीक न था कि मेंटली भाव ठीक न था कि सोशली भाव ठीक न था। ओके से व्यक्ति मानक आम फिजिकली चैलेंज्ड हैंडिकैप्ड व्यक्ति बोली कही था। So according to WHO, what is the physical PWD or physically challenged persons or handicapped persons? The persons who has the injury or disease or has the impairment or they are disability, handicapped. So persons who has the injury or a disease, impairment, disability, handicaps. So persons, so आम को व्यक्ति को handicapped कहते ना according to WHO the sequence of events leading to disability or and handicapped conditions that are follows injury or disease, impaired, disability, handicapped. जो व्यक्ति मान को जो व्यक्ति मैंने इम्पेयरमेंट अटंती से इंजुरी जो व्यक्ति मैंने पूरा इंजुरी रही से डिजीज इम्पेयरमेंट, डिजेबिलिटी, हैंडिकैप्ड से रही से व्यक्ति मानक आम डिजेबिलिटी भी हैंडिकैप्ड कंडीशन अच्छा बोली कही था। यह WHO ये डेफिनेशन WHO देते अकॉर्डिंग WHO द सीक्वेंस ऑफ इवेंट लीडिंग टू डिजेबिलिटी एंड हैंडिकैप्ड कंडीशन आर एज फॉलोज इंजुरी और डिजीज, इम्पेयरमेंट, डिजेबिलिटी, हैंडिकैप्ड। जो व्यक्ति माने इंजुरी अटंती, इम्पेयरमेंट रही से डिजेबिलिटी भी अटंती एवं हैंडिकैप अटंती से व्यक्ति मानक आम फिजिकली चैलेंज्ड कही से व्यक्ति मान फिजिकल चैलेंज्ड कह जाए। यह वर्ल्ड हेल्थ ऑर्गेनाइजेशन द्वारा WHO द्वारा कह जाए। फर्स्ट से दैट व्हाट इज इम्पेयरमेंट when the persons lost their ability in psychologically, physiologically and anatomical structural function। जो व्यक्तिर साइकोलॉजिकली से माने डिस्ट्रेस अटंती, साइकोलॉजिकली से माने एबनॉर्मालिटी अटंती, फिजियोलॉजी माने शारीरिक भाव से एबनॉर्मालिटी अटंती, तांकर बॉडीर जो ऑर्गन स्ट्रक्चर अच्छे से फंक्शन लॉस रही। तो impairment is defined as the loss of any function of the body part. It includes either physiologically or the anatomically, structurally, and losses in the losses in the memory, and also problem in the brain, and they have abnormality in the abnormality of the psychological। तो मानसिक स्तर भाव हो कि शारीरिक स्तर हो कि बॉडीर कौन से ऑर्गन फंक्शन हो कि स्ट्रक्चर हो जदि किसी एबनॉर्मालिटी आम पाई था कि से फंक्शन स्ट्रक्चर फंक्शन किसी स्ट्रक्चर फंक्शन किसी पार्ट ऑर्गन पार्ट किसी लॉस हो गला कि मानसिक स्तर भाव से एबनॉर्मालिटी अटे कि तार मेमोरी पावर लॉस हो जाए तो से व्यक्ति को आम इम्पेयरमेंट कहीचु। तो से व्यक्ति को इम्पेयरमेंट कह एग्जाम्पल इज द लॉस ऑफ विजन, हियरिंग। जो व्यक्ति विजन लॉस अच्छी से ठीक देखी पार ना कि ठीक भाव में शुणी पार ना से व्यक्ति मैंने को आम विजुअल इम्पेयरमेंट कही था हियरिंग इम्पेयरमेंट कही था। देन कम टू द डिजेबिलिटी। एग्जाम्पल ऑफ द डिजेबिलिटी लाइक द इफ एनीबॉडी लॉस्ट देयर लिम्स that person is said to the disability। it is a consequence of impairment। आम impairment जो मैंने रहा से impairment को आम disability ही कही था। ओके, so disability the inability to carry out certain activities। तो एथरे impairment रे disability कौन है ना व्यक्ति कौन सी एक्टिविटी ठीक भाव में कर पारा ना। impairment रे से कौन तार फिजियोलॉजिकली बा साइकोलॉजिकली एनाटॉमिकली एनाटॉमिकल स्ट्रक्चर रे से लॉस कला तार एबनॉर्मालिटी फाउंड किसी पाइले तो व्यक्ति इम्पेयरमेंट कहले। डिजेबिलिटी रे कौन व्यक्ति कौन कला ना कौन सी काम ठीक भाव में कर पारानी। इट इज ए कॉन्सिक्वेंस ऑफ इम्पेयरमेंट। एग्जाम्पल इज द लॉस ऑफ अ लिम्ब रिजल्ट इन इनएबल टू वर्क। जेहेतु डिजेबिलिटी गोटे एग्जाम्पल है जो कौन से हाथ बा गोड़ हर सारे जो आम गोड़ एक्सीडेंट रे कौन से व्यक्ति गोड़ हर थाए से ठीक से चली पारे ना। यह एक डिजेबिलिटी एग्जाम्पल अटे। ओके, देन कम टू द हैंडिकैप। इट डेभलप्स एज द कॉन्सिक्वेंस ऑफ डिजेबिलिटी। ताहले इम्पेयरमेंट रे कौन है कौन सी मानसिक स्तर हो शारीरिक स्तर हो एनाटॉमिकल स्ट्रक्चर हो ତାର ଫଙ୍କସନ୍ ଲସ୍ ହୋଇଯାଇଥାଏ କିମ୍ବା ମାନସିକ ସ୍ତରରେ ଆବନର୍ମାଲିଟି ଦେଖାଯାଇଥାଏ ବା ଶାରୀରିକ ସ୍ତରରେ କିଛି ଆବନର୍ମାଲିଟି ଫାଇଣ୍ଡ ଆଉଟ୍ ହୋଇଥାଏ, ତାହେଲେ ସେଇ ବ୍ୟକ୍ତିକୁ ଆମେ ଇମ୍ପାୟାରମେଣ୍ଟ କଣ୍ଡିସନ୍ ଅଛି ବୋଲି କୁହାଯାଇଥାଏ। ଏକ୍ଜାମ୍ପଲ୍ ଲସ୍ ଅଫ୍ ଭିଜନ୍, ହିୟରିଂ। ଡିଜାବିଲିଟି ହେଉଛି ଗୋଟେ ଇମ୍ପାୟାରମେଣ୍ଟର ଗୋଟେ ଷ୍ଟେଜ୍। ଯେଉଁ ବ୍ୟକ୍ତି ଇମ୍ପାୟାରମେଣ୍ଟରେ ରହିଥାନ୍ତି ସେ ବ୍ୟକ୍ତି ଆମେ ଡିଜାବିଲିଟି କହିଥାଉ। ଏଥିରେ କ'ଣ ହୁଏ, ଏକ୍ଜାମ୍ପଲ୍ ହେଉଛି ବ୍ୟକ୍ତି ଯଦି ଲିମ୍ସ ହରାଇ ସାରୁଛି ତାହେଲେ ସେ ଠିକ୍ ଭାବେ ଚାଲିପାରିନଥାଏ। ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ ଅଲସୋ ଇଟ୍ ଇଜ୍ ଡେଭଲପ୍ ଦ କନ୍ସିକ୍ୱେନ୍ସ ଅଫ୍ ଦ ଡିଜାବିଲିଟି। ଡିଜାବିଲିଟିରୁ ହିଁ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ ପର୍ସନ୍ ହୋଇଛି। ଡିଜାବିଲିଟି ହେଲା ପରେ ବ୍ୟକ୍ତି ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ କଣ୍ଡିସନ୍କୁ ଚାଲି ଯାଇଥାଏ। ଇଟ୍ ଡିପେଣ୍ଡ ଦ ଡିସ୍ଆଡ଼ଭାଣ୍ଟେଜ୍ ଅଫ୍ ଏ ଗିଭେନ୍ ଇଣ୍ଡିଭିଜୁଆଲ୍ ରେଜଲ୍ଟିଂ ଫ୍ରମ୍ ଦ ଇମ୍ପାୟାରମେଣ୍ଟ ଅର୍ ଡିଜାବିଲିଟି that limits and prevents the fulfillment of a role which is normal for that individual. It is depending on the age, sex and culture factor. ଯଦି କୌଣସି ବ୍ୟକ୍ତି ତା'ର କୌଣସି ରୋଲ୍ ନର୍ମାଲ୍ ହେଲ୍ଥ ଷ୍ଟେଟ୍ରେ ଯାହା କରୁଥିଲା ଠିକ୍ ଭାବରେ ସେ କରିପାରିଲା ନାହିଁ ଏବଂ ଏହା ଚିରସ୍ଥାୟୀ ହେଇକି ରହିଗଲା, ସେ ବ୍ୟକ୍ତିମାନଙ୍କୁ ଆମେ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ କହିଥାଉ। ଏହା ମଧ୍ୟ ଆମର ଏଜ୍, ସେକ୍ସ, କଲଚର୍ ଫ୍ୟାକ୍ଟର ଉପରେ ଡିପେଣ୍ଡ କରୁଛି। ଓକେ, କାହିଁକିନା ଯେଉଁ ବ୍ୟକ୍ତି ଆମେ ବ୍ଲାଇଣ୍ଡନେସ୍ ହେଇଯାଉଥାନ୍ତି ତାହା କଲଚର୍ ଫ୍ୟାକ୍ଟର ଯଥା ଇକୋନୋମିକାଲ୍ ସିଚୁଏସନ୍ ଯୋଗୁଁ ହୋଇଥାଏ। କାହିଁକିନା ତାଙ୍କର ସେ ଦାରିଦ୍ର୍ୟ ସୀମାରେଖା ତଳେ ରହିଥାନ୍ତି, ପୋଭର୍ଟି କଣ୍ଡିସନ୍ ତାଙ୍କର, ସେମାନେ ପୋଭର୍ଟି ଥାନ୍ତି। ସେଥିପାଇଁ ଏଠି ଇକୋନୋମିକ୍ ଷ୍ଟାଟସ୍ ହେଉଛି ଗୋଟେ କଣ୍ଡିସନ୍, ହେଉଛି କଲଚର୍ ଫ୍ୟାକ୍ଟର ଯେଉଁଥିରେ କି ବ୍ୟକ୍ତି ବ୍ଲାଇଣ୍ଡନେସ୍ କଣ୍ଡିସନ୍କୁ ଯାଇଥାଏ। ତାହେଲେ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ ହେବା ପାଇଁ ବ୍ୟକ୍ତି ମଧ୍ୟ ତା'ର ଏଜ୍, ସେକ୍ସ କିମ୍ବା କଲଚର୍ ଫ୍ୟାକ୍ଟର ଉପରେ ଡିପେଣ୍ଡ କରିଥାଏ। ଯଦି ଏଜ୍ ଅଧିକ ହେଲା ସେ ମଧ୍ୟ ବ୍ଲାଇଣ୍ଡନେସ୍ ହେଇଯାଉଛି। ତ ଏସବୁ ଗୋଟେ ଏକ୍ଜାମ୍ପଲ୍, ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ ଗୋଟେ ଏକ୍ଜାମ୍ପଲ୍ ଅଟେ। ଦ ପର୍ସନ୍ସ ହୁ ଆର୍ ଦ ଅର୍ଥୋପେଡିକାଲି handicapped persons, the person should be orthopedic handicapped when defected or impairment arises during the congenital stage or during the birth stage. The person goes to the orthopedically handicapped. At that time persons has the birth defect like the club foot or any like the rickets, fracture, arthritis, leprosy due to the amputation due to the accidental injury. କେଉଁ ବ୍ୟକ୍ତିମାନେ ଅର୍ଥୋପେଡ଼ିକ୍ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ କୁହାଯାଇଥାଏ, ଯେଉଁ ବ୍ୟକ୍ତିମାନେ ଜନ୍ମରୁ ଡିଫେକ୍ଟ ଅଟନ୍ତି। ଏକ୍ଜାମ୍ପଲ୍ କ୍ଲେଫ୍ଟ ଲିପ୍, କ୍ଲେଫ୍ଟ ପାଲେଟ୍। ଗ୍ରହଣ ଖଣ୍ଡିଆ, କଟା ତାଳୁ ଯେଉଁଟା ଆମର ଗୋଟେ ଏକ୍ଜାମ୍ପଲ୍। ଦୁଇଟାକ ଲିପ୍ସ ଭିତରେ କିଛି ଓପନିଂ ପ୍ଲେସ୍ ଥାଏ ଏବଂ ଦୁଇଟାକ ଲିପ୍ସ ଠିକ୍ ଭାବରେ ଜଏଣ୍ଟ ହୋଇନଥାଏ, ତାକୁ ଆମେ କ୍ଲେଫ୍ଟ ଲିପ୍ କହିଥାଉ। ଏବଂ କଟା ତାଳୁ ମାନେ ଆମର ଯେଉଁ ସଫ୍ଟ ପାଲେଟ୍ ରହିଛି, ହାର୍ଡ଼ ପାଲେଟ୍, ସଫ୍ଟ ପାଲେଟ୍ ଯେଉଁ ରହିଛି ସେ ଭିତରେ କମ୍ବିନେସନ୍ ଠିକ୍ ନଥାଏ। ତ ଗ୍ରହଣ ଖଣ୍ଡିଆ, କଟା ତାଳୁ ଗୋଟେ ହେଉଛି କଞ୍ଜେନିଟାଲ୍ ବାର୍ଥ ଡିଫେକ୍ଟ, ସେ ବ୍ୟକ୍ତିମାନଙ୍କୁ ମଧ୍ୟ। ଆଉ ଗୋଟେ କ୍ଲବ୍ ଫୁଟ୍ ଗୋଟେ ଅନଦର ଏକ୍ଜାମ୍ପଲ୍, ଏହା ଅର୍ଥୋପେଡ଼ିକ୍ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟ ମଧ୍ୟରେ ଯାଉଛି। ଯେଉଁ ବ୍ୟକ୍ତିର ଆକ୍ସିଡେଣ୍ଟ ଇଞ୍ଜୁରି ହେଲା ସାଧାରଣତଃ ଆମେ ସେଇ ଗୋଡ଼କୁ ବାହାର କରାଯାଇଥାଏ ଏବଂ ଆର୍ଟିଫିସିଆଲ୍ ଲେଗ୍ ଲଗାଇଥାଏ, ସେ ବ୍ୟକ୍ତି ମଧ୍ୟ ଅର୍ଥୋପେଡ଼ିକ୍ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟରେ କାଉଣ୍ଟ କରାଯାଇଥାଏ। ଫ୍ରାକ୍ଚର ବ୍ୟକ୍ତି, ଆର୍ଥ୍ରାଇଟିସ୍ କଣ୍ଡିସନ୍ ବ୍ୟକ୍ତି, ଲେପ୍ରୋସି ବ୍ୟକ୍ତି, ରିକେଟ୍ସ ବ୍ୟକ୍ତି ମଧ୍ୟ ଅର୍ଥୋପେଡ଼ିକ୍ ହ୍ୟାଣ୍ଡିକ୍ୟାପ୍ଟରେ କାଉଣ୍ଟ କରାଯାଇଥାଏ। ଭିଜୁଆଲ୍ ପ୍ରୋବ୍ଲେମ୍ like the partial or complete blindness, repeated error persons also count in the handicapped persons. Auditory problems like the partial hearing loss, deaf and dumb persons also count in the handicapped persons. The persons who have the speech problem like the stammering and dysphonia, in the stammering persons speech problem, it is seen in the children. Always repeat the sounds like the moo moo moo, mommy, that like, or you make a sound like moo moo moo, mommy, that like, it is example. So it is a very speech problem in children. Here children repeat the sounds like the moo 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 moo, mommy, that like said, or also said that mommy, that like is that. It is a stammering stage of the child, where the child, it is a very common speech problem in the children. Okay, then next condition is the dysphonia. The dysphonia, it is also child the persons produce abnormal voices, rough edge voices, weak voices, and it is known as hoarseness voices. Also, the speech problem persons also known due to the speech problem, that persons also undergo the handicapped. And the neurological handicapped, the persons who are remain under the cerebral palsy. The cerebral palsy is a group of disorder where the persons lost their balance and posture, cannot maintain their balance and postures, and there is impaired the muscle coordinations. And the mental retarded persons who have the loss of the memory power, and the persons who have the convulsive disorder like the uncontrollable muscle contractions. Here it is known as also seizure, where uncontrollable discharge of electrical neurons occurs. Convulsion stage जोटा बात मारिया कही था, तो जो व्यक्ति को कन्वल्सन स्टेज रही था से मसल कोऑर्डिनेशन ठीक न थाए एवं इलेक्ट्रिकल डिस्चार्ज न्यूरॉन ब्रेन में बारंबार होता है. Abnormal electrical discharge neurons occurs in the brain, that person on convulsions. So there is uncontrollable muscle coordination occurs, that known as convulsive disorder. Hydrocephalus persons, meningitis persons, inflammation of the brain, and degenerative disease where the tissue deterioration occur and tissue losses their function due to the trauma and injury, and if that disease occurs in the CNS, central nervous system. The persons also in the heart disease, bronchial asthma, diabetic mellitus, that persons also including the handicapped if they are lost their functions or goes to the paralysis, certain type of disease. Multiple physical handicapped children also be seen in the multiple physical handicapped children. Both handicapped there is common like the sometimes speech problem with auditory problems, visual problems with orthopedical problems. So both combinations occurs. If the combinations of handicapped occurs, that is known as multiple physical handicapped. Okay. So causes why handicap persons goes to handicapped due to the congenital anomalies, like the any time of a defect will be seen in during the birth, like the cleft lip, cleft part, ground अधा तालु ground खंडिया टाइप रो जेमति कि लिप्स मझरे दुटा लिप्स ठीक जोड़ी न थाए किबा सब पैलेट दुटा को ठीक जॉइंट न थाए. Claw foot, cleft lip, cleft palate. So these are common example of the. And cerebral palsy, spinal bifida, these are common example of the congenital anomalies. Genetic disorder, poliomyelitis, due to it is a this type of poliomyelitis, it is a disease caused by the poliovirus, by which person goes to the paralysis. Poliomyelitis is another cause to poliomyelitis is another cause of the physical handicapped. Perinatal conditions, from the pregnant to the baby birth, at that time any type of disease occurs that causes the handicapped. Infection, malnutrition, accidental injury, that causes the persons who are goes to the handicapped. Next, the management. So here the in the management to the how why management is in the management we also know about that. What are the information provided by the teachers, caregivers, advocate. What are the informations provided by the teachers, caregiver, etc. to the individuals, the society, how to prevent the disability, and what are the sources of disability, why disability occurs. So आमे कौन करबा टीचर हो, caregiver हो, तो केमिति आमे केमिति handicapped person handicapped होबा नै एबा पर्सन से डिसेबिलिटी होबा नै सेथि पय से इन्फॉर्मेशन गुडा को सोसाइटी को देई थाउ जा फल कि डिसेबिलिटी को रोकी थाए. तो सेथि पय टीचर कोन रोल थाए in the so here teacher provide the informations So here the nurses role as a teacher. एथिरे नर्स कौन करे टीचर रोल करता है. ये टीचर रोल कौन हुए टीचर रोल रे कौन नर्स कौन करे ना शेयरिंग द इन्फॉर्मेशन अबाउट द डिजीज प्रोसेस अंडरलाइंग द डिजेबिलिटी एंड टीच टेक्निक टू हेल्प द क्लाइंट देयर फैमिलीज. ताले डिजीज कहीं केमिति होची से विषय आम कौन करवा क्लाइंट को ता फैमिली मेंबर को भल बुझेबा जहाँफल कि आ डिजेबिलिटी अन्य कौन फैमिली मेंबर को अटैक कर ना. ओके. And also develop a self-care skills by which persons do their eating, maintaining the groomings, toileting, etc. It is better helpful for the illness continuum. Okay. It is necessary for the good health also, and prepare the client and family for the future self-management decision making. Then come to the caregiver. So here the nurses role as the caregiver. Here as nurse is a caregiver, so that he has a capacity or power to assess the physical, psychological, sociological and spiritual dimension of the client. तेणु caregiver रे कौन हम client रो physically, psychologically, sociological, spiritual dimension कौन रही client family विषय जानवा उचित एवं ताको एजुकेशन दे थाए एवं को टाइप तार को सोर्स रु डिजेबिलिटी होइछि बा कोन तार प्रॉब्लम तार को प्रॉब्लम से फेस करूछि तो भल डायग्नोस करे तापरे देन ही परफॉर्म ए प्लान then spend their ideas and in the implementation stage they do the all activities. Okay. Give the therapeutic and supportive relationship. Okay. Then implement a plan by which you provide the care and give the education, dietary, restore function, prevent complication for the losses. ताले कौन करेंगे एथरे केयर गिवर हिसाब नर्स कौन करेंगे क्लाइंट फैमिली मेंबर फिजिकली साइकोलॉजी सोशली स्पिरिचुअल डायमेंशन कौन रही ठीक जानी थाए एवं तार प्रोब्लेम तार जो डिजीज कौटू क्रिएट होची जोटा कि फिजिकल हैंडिकैप्ट व्यक्ति करवा को आगू को नहीं थाए ताले से कौन तार सब प्रोब्लेम रोग रही जहाँकि व्यक्ति को फ्यूचर को हैंडिकैप्ट करे दे थाए करईदब तो से रोग को भल भाव से जानी थाए एवं ताको डायग्नोस करे तापर प्लानिंग तैयारी करे बाय अकॉर्डिंग टू knowledge. So he also provided therapeutic and supportive relationship at that time. Then implement a plan of care providing then we implement a plan of care, then provide the nursing care and give education diet to the client. Then come the collaborator. Nurses role as the collaborator. Here nurses develop a goal by which after the providing the by keeping the goal, then he perform the plan, then perform the plan of a care, then he go through the implementation stage by which all the plans whatever he think then he will apply it, then the disease will be curable. He thinks that disease will be curable and it is not goes to the future stage what is the causes the PWD or personal disability. ताले एथरे व्यक्ति को कोलाबोरेटिव स्टेज कहते व्यक्ति गोटे गोल व्यक्ति तार निजर गोटे गोल तैयारी करे जो थे कि क्लाइंट नर्स एथरे गोटे गोल नर्स कौन कौन गोल नर्स मन भर गोटे गोल रखे जो गोल रे कौन हुए ना एम रखी थाए जो एम रे कौन हुए ना तार क्लाइंट फैमिली मेंबर सहित गोटे कोलाबोरेटर रखिकी प्रोब्लेम जो फेस आउट होता से प्रोब्लेम को किंतु सॉल्व करने ट्राई करी थाए. And also nurses also oriented to the wellness behavior and also encourage socialization with others. एथरे कौन करे पुणी नर्स कौन करे ना क्लाइंट फैमिली मेंबर को किंतु सोसाइटी सहित मिलमिशि चलिया एनकरेज करे थाए एवं ओरिएंट टू किंतु भल भाव बिहेव मेंटेन करने ओरिएंटेशन करी थाए. Also he always keep maintain eye care with other health team members and call the other members as for necessary and also develop the professional health integrity by the other health team member. They provided optimal opportunity for the recovery of the plant. Okay, and also collaborate with the nurse also collaborate with the other team member to achieve cost effective care by using the appropriate technology. ताले एथरे कोलाबोरेटरी स्टेज रे कोन हला ना नर्स कोन गला मन भीतर गोटे गोल क्रिएट कला जो गोल द्वारा कोन हुए जो कौन प्रॉब्लम कम आउट प्रॉब्लम फेस कला से प्रॉब्लम को सॉल्व करबा में ट्राई कला एथरे प्लानिंग तैयारी कला एवं जो प्लान कला से जिनस को से परमति मध्य अप्लाई कला एवं प्रॉब्लम को सॉर्ट आउट करके सॉल्व कर ट्राई करता है एवं एथरे क्लाइंट फैमिली मेंबर केमती सोसाइटी सहित भल भाव में मिलमिशि रहीपर एवं से मैंने केमती भल बिहेवियर देखीपारे और अदर हेल्थ टीम मेंबर सहित भल भाव में कम करेंगे जो दरकार से डकई था एवं व्यक्तिर रिकवरी ट्राई कर अप्रोव टेक्नोलोजी द्वारा अन्य टीम मेंबर सहित भल भाव में कोलाबोरेशन रखी थाए. देन नर्स रोल एज द क्लाइंट एडवोकेट. हियर nurses also guide the client and family members during the grieving process during the emotion stage where the client and family member loses the ability and roles. At that time client nurses role as advocate against the client and give reassurance to the client and what are the policies and services are there that also advocated to the client and promote the quality of life of the individual. Okay, तो client advocate stage पे कौन हुए नर्सेस कौन करे क्लाइंट को गाइड करि थाए फैमिली मेंबर गाइड करि थाए एवं जदि किसी ग्रीफ कंडीशन रे अछंती देखले जे नर्स जले देखले जे क्लाइंट और फैमिली मेंबर किसी ग्रीफ कंडीशन रहउछंती ताहले एबा तांकर किसी एबिलिटी लॉस हेउची ताहले सेतले तांको रिएश्योरेंस दउछंती एतले कौन सी व्यक्ति बा फैमिली मेंबर किसी व्यक्ति बा काम कौन सी काम लॉस हो गला बा कौन सी व्यक्ति चलीगला ताले फैमिली मेंबर क्लाइंट कौन करती गोटे इमोशनल स्टेज रहती जो थे कि क्राइंग सिचुएसन रही था कि सैडनेस कंडीशन रही था तो ताकू दूरिया क्लाइंट ये ताकू दूरिया नर्स कौन करे गोटे एडवोकेट हिसाब से क्लाइंट को गाइड करे रिएश्योरेंस दे था इमोशनल साइकिल सपोर्ट दे था और जहाँ जहाँ पॉलिस सर्विस हॉस्पिटल रही पॉलिस सर्विस जहाँ सब रही गोटे लाइफ डेवलपमेंट ता विषय एडवोकेट करें ता विषय इंस्ट्रक्शन दे था. ओके, these are the management of the against the handicapped or impairment or disability. Then come to the respiration or distress. तो respiration condition रे पेशेंट केमती डिस्ट्रेस भी रोच. ओके, तो ता विषय हम डिस्क्राइब करबा. Then come let us see the topic. So respiration distress. First definition: it is a group of signs and symptoms resulting in the acute respiratory failure, characterized clinically by tachypnea, dyspnea, tachycardia, cyanosis, and low partial oxygen that persist even with oxygen therapy. Okay. So respiration or distress is a group of sign symptom. Sign symptom like the tachypnea, where respiration rate is above than 100, dyspnea, where the patient feels difficult to breathe, tachycardia, where the pulse rate is above 100, and in the cyanosis condition, when the patient skin becomes bluishness, and there has the low partial pressure of oxygen. The partial pressure of oxygen becomes low even after supplying of the oxygen therapy. Okay. So partial pressure of oxygen is the oxygen presence in the arterial blood. So partial pressure oxygen means oxygen present in the arterial blood that move in through by the arterial wall. Okay, so that is known as the partial pressure of oxygen. So partial oxygen means oxygen is flow through by the blood. The flow so oxygen flow through by the blood it becomes very, very low even providing the oxygen therapy. जब oxygen therapy देगी मध्य कौन हुए ना ब्लड रे ऑक्सीजन लेवल टा कमी जाय थाए, पार्शियल प्रेशर ऑक्सीजन कमी जाय थाए. ओके, आमर ब्लड नॉर्मल पार्शियल प्रेशर ऑक्सीजन होची 7 to 100 मिलीमीटर ताले पार्शियल प्रेशर ऑक्सीजन ब्लड रे कोन होता कमी जाए 75 to 100 भीतर जो रहिबा कथा किंतु से 75 बिलो 75 को चली जाई थाए ओके So partial pressure oxygen, it is a measurement of oxygen presence in arterial blood. It reflects how well oxygen able to move from lung to the blood and altered by the severe illness. तो ये कहला ना पार्शियल प्रेशर ऑक्सीजन कौन हो ना कमी जाए थाए पार्शियल प्रेशर ऑक्सीजन होची कोन ना ना इट इज मेजरमेंट ऑफ ऑक्सीजन इन द आर्terial blood जो ऑक्सीजन लेवलटा जेतिक रही ताको हम पार्शियल प्रेशर ऑक्सीजन कहि थाउ एथरे ऑक्सीजन केमिति लंग्स रु ब्लड को केमिति केते परिमाण जाउछि ता मते जानि होइथाय एवं जदि जेते व्यक्ति को जेते इलनेस कंडीशन व्यक्ति थाए सेतले से अल्ट्रेशन हो जाए हमर नॉर्मल पार्शियल प्रेशर ऑक्सीजन होछि ब्लड केते ना 75 to 100 मिलीमीटर साधारणतः रेस्पिरेशन कंडीशन रे 75 रु 100 रु ए ऑक्सीजन लेवल कमी जाय थाए ओके जदि भी हम ऑक्सीजन थेरेपी देई थाउ से ताहा देइथिले मध्ये भी पार्शियल प्रेशर ऑक्सीजन कमी जाय थाए पार्शियल ऑक्सीजन 75 to 100 मिलीमीटर रु कमी जाय थाए ओके आमे कहीं पार्शियल प्रेशर ऑक्सीजन मापी थाउ पार्शियल प्रेशर ऑक्सीजन मापियर मेन कज हला आज ऑक्सीजन लेवल आर्टेरियल ब्लड केते रहउची केते परिमाण ब्लड लंग्स रु केते परिमाण ऑक्सीजन लेवल ब्लड सहित लंग्स रु ब्लड वेसल को जाउची ओके साधारण सिवियर इलनेस कंडीशन रे कोन हुए ना ऑक्सीजन लेवलटा पार्शियल ऑक्सीजन लेवलटा ऑक्सीजन लेवलटा वेरी करि थाए ओके सो डिफरेंट टाइप कॉजेस फॉर द रेस्पिरेशन और डिस्ट्रेस लाइक द pneumothorax it becomes open or closed okay so pneumothorax is the abnormal collection of air in the pleural space between lung and chest wall रो जो pleural space रही सेतरे जदी abnormally air collection होगी रहिला ताको pneumothorax कहि थाउ if there presence of air if there is no air clearance or air obstruction is there that also causes the respiration distress pneumothorax condition को होला ना pleural जो lung चेस्ट वाल भितर जो एयर लंग चेस्ट वाल भितर जो प्लूरल स्पेस रही से कौन हुए ना एयर गुड़ाक आकुमुलेट होकर रही जाती ओके ताको आम निमोथोराक्स कही था निमोथोराक्स इज ए abnormal collection of the air in the pleural space between lung and chest wall so by which patient feel the chest pain and there are presence of shortness of breath or breathing difficulty निमोथोराक्स कंडीशन रे जेहेतु एयर गुड़ाक लंग और चेस्ट वाल भितर जो प्लूरल स्पेस रही है आकुमुलेसन होकर एयर गुड़ाक रही जाती जहाँफल कि पेसेंट को चेस्ट पेन हुए पेसेंट ब्रीदिंग डिफिकल्टी फेस करे जिते एयरवे क्लीयरेंस होना एयरवे ऑब्स्ट्रक्शन रोचे निमोथोराक्स रेस्पिरेशन और डिस्ट्रेस कंडीशन रे व्यक्ति चली जाए पल्मोनरी कंटिजन इन द पल्मोनरी कंटिजन व्हाट हैपन in the pulmonary contagion there are capillaries blood vessels becomes damaged and in the lung tissue other fluids are accumulated excess fluid enter by the gas exchange leading to inadequate oxygen levels in the blood that lead to hypoxia तले pulmonary contagion stage रे कोन हुए ना हमरा जेतले कैपिलरीज गुडा बा ब्लड वेसल गुडा डैमेज हो जाती बहुत गुडे फ्लूइड लंग्स टिश्यू रे डिपोजिट हो जाती एवं एक्सेस फ्लूइड कौन करे ना गैस एक्सचेंज ठीक भाव कर दिए ना एवं जहाँफल कि ब्लड रे ऑक्सीजन लेवल कमी जाए था व्यक्ति हाइपोक्सिया कंडीशन को चली जाए ताको हम पल्मोनरी कंटिजन कही था देन द कम टू द फेल चेस्ट इन द फेल चेस्ट here the segment of a rib cage becomes broken due to the trauma or any type of injury in the chest wall एतले चेस्ट वाले कौन सी इंजुरी ट्रमा है से रिब केज सेगमेंटा भांगी जाए ताको फेल चेस्ट कही था एवं देन द टेंशन निमोथोराक्स इन द टेंशन निमोथोराक्स दैट इज रिजल्ट फ्रॉम द चेस्ट इंजुरी एवं डैमेज फ्रॉम द अंडरलाइंग लंग डिजीज जिते चेस्ट इंजुरी होता है ଯେତେବେଳେ ପ୍ଲୁରାଲ୍ ସ୍ପେସ୍ରେ ବହୁତ ପରିମାଣରେ ଏୟାର ମଧ୍ୟ ରହିଯାଇଥାଏ ସେମାନେ ଆଉ ବାହାରକୁ ବାହାରି ପାରନ୍ତି ନାହିଁ, ଯାହାଫଳରେ କି ଇଣ୍ଟ୍ରାଥୋରାସିକ୍ ପ୍ରେସର ବଢ଼ିଯାଇଥାଏ, ଭେନସ୍ ରିଟର୍ନ କମିଯାଇଥାଏ, ତାହାକୁ ଆମେ ଟେନସନ୍ ନିମୋଥୋରାକ୍ସ କହିଥାଉ। ସେ ଟେନସନ୍ ନିମୋଥୋରାକ୍ସ ମାଧ୍ୟମରେ ରେସ୍ପିରେସନ୍ ପାଟର୍ଣ୍ଣରେ ଡିସଫଙ୍କସନ୍ ହୋଇଯାଏ, ବ୍ୟକ୍ତି ଠିକ୍ ଭାବେ ରେସ୍ପିରେସନ୍ କରିପାରେ ନାହିଁ ଏବଂ ଡିସ୍ନିଆ କଣ୍ଡିସନକୁ ଚାଲିଯାଇଥାଏ। ନେକ୍ସଟ ହିମୋଥୋରାକ୍ସ, କଲେକ୍ସନ୍ ଅଫ୍ ବ୍ଲଡ଼ ଇନ୍ ଦ ପ୍ଲୁରାଲ୍ ସ୍ପେସ୍ ବିଟୱିନ୍ ଦ ଲଙ୍ଗ ଆଣ୍ଡ ଚେଷ୍ଟ ୱାଲ୍। ଲଙ୍ଗ ଆଉ ଚେଷ୍ଟ ୱାଲ୍ରେ ଯେତେବେଳେ କ'ଣ ହୁଏ ନା ବ୍ଲଡ଼ ଗୁଡ଼ାକ କଲେକ୍ସନ୍ ହୋଇକି ରହନ୍ତି, ସେତେବେଳେ ଆମେ ସେଇ କଣ୍ଡିସନକୁ ହିମୋଥୋରାକ୍ସ କହିଥାଉ। ଦେନ୍ ଦ କମ୍ ଟୁ ଦ ଡାଇଫ୍ରାଗ୍ମାଟିକ୍ ହାର୍ନିଆ। Diaphragmatic hernia also is a birth defect where there is a hole in the diaphragm by which all the organs from the abdomen like the intestine, stomach, liver can move through the hole in the diaphragm and upward into the body chest। ताले आम जानिले आउ थे कही निमोथोराक्स हूँ जिते चेस्ट वाल और लंग्स भितर जो प्लूराल स्पेस रही है एयर गुड़ाक accumulation होकर रहती। निमोथोरासिक कंडीशन इन विच accumulation of or gather of the air in the pleural space between the chest wall lung that causes the respirations. When the airway blockage that is known as airway obstruction, it is also developed to the respiration distress, and in the pulmonary contagion that is result from the chest injury or chest trauma or any other fluid accumulations, blood capillaries damaged, blood vessels damaged. It interferes the gas exchange and leading to the low level of oxygen flows in the blood. It causes the hypoxia condition because tissue receives the lack of oxygen. In the failed chest, when the rib cage becomes broken down, that causes the difficulty breathing. In the tension pneumothorax, that is result from the chest injury, and where the intrathoracic pressure increased, that causes the decreased venous return, causes the breathing difficulty also. In the hemothorax, collection of blood between the chest wall and the lungs. The diaphragmatic hernia, hole occurs in the diaphragm by which stomach, liver, intestine from the abdomen comes to upward through the hole of the diaphragm. The diaphragmatic hernia रे कौन हुए ना diaphragm गोटे होल हो जाए जहाँकि abdomen रू चेस्ट को सेपरेट करता है। से होल द्वारा कौन हुए ना जहाँ सब स्टोमाक लिवर इंटेस्टाइन रही से होल मध्यम बाहर को बाहरी आसते बाहर को होल मध्य देकी से कौन होती ना डायफ्राग्म ऊपर भाग को पलि आसता। There are two types of respiration distress. First, the type 1, type 2. In the type 1, there are respiratory failure is developed. The respiratory failure is defined as the hypoxia due to the lack of oxygen in the tissue, but without hypercapnia. And indeed the partial carbon dioxide may be normal or low. So type 1 respiratory failure कौन हुए ना हाइपोक्सिया कंडीशन डेवलप होता है कहीं टिश्यू को ऑक्सीजन परिमाण बहुत कम परिमाण जाए एवं व्यक्ति को हाइपरकाप्निया कंडीशन न थाए। दैट मीन्स कार्बन डाइऑक्साइड लेवल देयर हैज नो low level of carbon dioxide in the blood, and here the partial carbon dioxide becomes normal or low. The partial pressure of the carbon dioxide is range about the partial pressure of carbon dioxide is about 38 to 40 millimeter mercury. The partial pressure of carbon dioxide is about 38 to 42 millimeter mercury. Okay. ताले टाइप 1 जो रेस्पिरेटरी फेलियर रोची सेथरे व्यक्ति हाइपोक्सिया कंडीशन रोची। इन द टाइप 1 रेस्पिरेटरी फेलियर द पर्सन्स goes under the hypoxia condition because lack of oxygen reaches to the tissue. The persons are not having the hypercapnia but causing the hypoxia condition. The persons in the hypoxia condition, there is no low level of carbon dioxide in the blood. Here there is no carbon dioxide, low level of carbon dioxide in the blood, but persons has the hypoxia conditions. But partial pressure of carbon dioxide becomes normal. It becomes range between 38 to 40 millimeter mercury, और समटाइम्स बिकम्स लो. ताले जो टाइप 1 रेस्पिरेटरी डिस्ट्रेस रहा से कौन हुए ना व्यक्ति हाइपोक्सिया कंडीशन थाए, किंतु जोटा कि हाइपोक्सिया कंडीशन थाए जो थे कि टिश्यू को कंपाउंड ऑक्सीजन आसी थाए एवं व्यक्ति किंतु हाइपर कापनिया कंडीशन रे न थाई मध्य हाइपोक्सिया कंडीशन थाए. ताले हाइपर कापनिया कंडीशन रे व्यक्तिर ब्लड रे कार्बन डाइऑक्साइड लेवल कम न थाए, बट व्यक्ति कौन कर थाए ना हाइपोक्सिया कंडीशन रे थाए. व्यक्तिर टिश्यू कंपाउंड ऑक्सीजन ग्रहण करि थाए, किंतु एपटे देखा गले जे व्यक्तिर ब्लड रे कार्बन डाइऑक्साइड लेवलटा कम न थाए. किंतु एथरे पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड इन द ब्लड जो देखा ब्लड रे कार्बन डाइऑक्साइड लेवलटा आइदर नॉर्मल थाए कि लो होई थाए. तो पार्शियल प्रेशर कार्बन डाइऑक्साइड इन द ब्लड इज रेंज इज 32 to 48 मिलीमीटर मर्क्यूरी. ब्लड रे पार्शियल प्रेशर कार्बन डाइऑक्साइड केतने रही थाए ना 38 to 42 मिलीमीटर मर्क्यूरी थाए, जोटा कि सेठू ये टाइप 1 कंडीशन रे नॉर्मल थाए कि लो रही थाए. तो टाइप 1 डिस्ट्रेस caused by ventilation or perfusion mismatch. ventilation perfusion mismatch जो हो जाए तो टाइप 1 डिस्ट्रेस बा टाइप 1 रेस्पिरेशन देखा जाए थाए, जो थे कि वॉल्यूम ऑफ एयर फ्लोइंग इन एंड आउट ऑफ द लंग्स बिकम्स मिसमैच. लंग्स रो जो एयरटा आसी थाए कि भीतर एंट्री करते हैं भीतर मिसमैच देखा थाए. ब्लड फ्लो जो लंग्स को जो ब्लड फ्लो होता है से मिसमैच देखा थाए. ब्लड लंग्स जो ब्लड जाए थाए लंग्स रो जो ब्लड आसी थाए ता भीतर फ्लो मध्य भी डिफरेंट आसी थाए. ओके, मिसमैच आसी थाए. जिते व्यक्ति को रेस्पिरेटरी फेलियर कंडीशन रही थाए तार से आम ऑक्सीजनेशन जानिले जे व्यक्ति हाइपोक्सिया कंडीशन थाए एवं कार्बन डाइऑक्साइड लेवलटा व्यक्ति हाइपोक्सिया कंडीशन थाए, जो थे कि ऑक्सीजन लेवलटा टिश्यू रे बहुत कमी जाए थाए, ब्लड कमी जाए थाए, जोटा कि टिश्यू ठीक भाव ग्रहण कर न थाए, किंतु ब्लड रे कार्बन डाइऑक्साइड लेवलटा कमी न थाए. ओके, ताले व्यक्ति जो रेस्पिरेटरी फेलियर कंडीशन थाए से आम जो ऑक्सीजन कंडीशन विषय कनसीडर करवा ताले एथरे हम देखिए पार्शियल प्रेशर ऑफ ऑक्सीजन और मेजरमेंट ऑफ ऑक्सीजन इन द ब्लड इज लेस दैन 60 mmHg और 8 किलो पास्कल. तार व्यक्तिर नॉर्मल ऑक्सीजन लेवल्स ब्लड रे केते रहबा उचित, व्यक्तिर नॉर्मल पार्शियल प्रेशर ऑफ ऑक्सीजन ब्लड रे केते रहबा उचित ना 7 to 100 रहबा उचित. किंतु व्यक्तिर जतले 60 तौल को 60 मिलीमीटर मर्क्यूरी कमी जाऊँ व्यक्तिर पार्शियल ऑक्सीजन से व्यक्ति को रेस्पिरेटरी फेलियर होची, कहीं ना एथरे लो लेवल ऑफ ऑक्सीजन रिचेस टू द टिश्यू. एथरे पार्शियल प्रेशर ऑफ कार्बन डाइऑक्साइड बिकम्स नॉर्मल, आइदर इट बिकम 38 to 48 और बिकम्स लो देन 38 to 42. देन पार्शियल प्रेशर ऑफ ऑक्सीजन also increased at certain types. ताले ये टाइप रेस्पिरेटरी फेलियर कहीं विभिन्न कज रही है. पैरेनकाइमल डिजीज जोटा अच्छी जोटा कि पैरेनकाइमल डिजीज लंग्स पैरेनकाइमल डिजीज जो जोटा वेंट्रिकुलर परफ्यूजन इन वॉल्यूम ऑफ एयर फ्लोइंग इनटू द लंग्स एंड आउट ऑफ लंग्स बिकम्स मिसमैच by that way due to the parenchymal disease the type 1 respiratory distress occurs. And disease of the vasculature and shunts, right to left shunt, pulmonary embolism, one or more artery becomes blocked due to the that condition known as pulmonary embolism, by which respiratory distress occurs. And from the right to left shunt, by which blood comes from the right of the heart to left heart, example cardiac shunt. So if any disease occurs in the cardiac shunt or the pulmonary cardiac shunt or due to the pulmonary embolism, that also develop the respiratory distress. Other lung disease like the acute respiratory distress syndrome. So acute respiratory distress syndrome is the collection of fluid in the air sac by which organs becomes deprived of oxygen. ताले जेहेतु एयर सैक्रे बहुत गुटे फ्लूइड कलेक्शन होकर रही जाऊँगी प्रत्येक ऑर्गन ठीक भाव ऑक्सीजन नहीं पारती ना तो या कहते एक्यूट रेस्पिरेटरी डिस्ट्रेस सिंड्रोम ओके देन कंडीशन निमोनिया इन द निमोनिया कंडीशंस ड्यू टू द inflammation occurs by the bacterial and viral infection air sac filled with the pus that is known as pneumonia. And emphysema in the emphysema conditions air sac of a lung becomes damaged. So when the air sac of lungs becomes damaged, that is known as emphysema. Okay, and in the pneumonia air sac is filled with the pus, and the acute respiratory distress syndrome that is occurs due to the fluid accumulation in the air sac, fluid quality in the air sac. Then come to the type 2 respiratory distress, where the respiratory failure occurs due to the partial pressure of oxygen becomes decreased, a major amount of oxygen flow in the blood decreased, partial pressure of carbon dioxide also be partial pressure of carbon dioxide increased, oxygen carbon dioxide levels in the blood becomes increased, or partial pressure of oxygen becomes normal, or pH of the blood becomes decreased. The pH value of the blood is about 7.38 to 7.42. So type 2 respiratory failure caused by the inadequate ventilations, because here both oxygen and carbon dioxide becomes affected, and the partial pressure of carbon dioxide or carbon dioxide levels becomes increased or becomes gradually increased, so that for that reasons oxygen levels low, and low level of oxygen discharged to the tissue where the carbon dioxide levels increased in the blood, so that is known as the respiratory distress condition increased, where the person goes to the fatal stage. What are the causes of the respiratory failure? Sometimes causes like the chronic obstructive pulmonary disease known as the COPD, where the airflow becomes blocked and difficult to the breathing. Due to the asthma is a condition where bronchi becomes spasm occurs in the bronchi, and there is a person's airway becomes narrow, impairment and swallowed, so causing the difficulty in breathing. And in the suffocations, persons becomes deprived of air and unable to breathe. So these are common conditions where it is developed the type 2 respiratory distress. Next is the patient's assessment. So respiratory failure is a life-threatening condition. Persons remains in the fatal stage, and at last the person goes to death. So first is for the assessment of patient has the general presentation. When you see the patient with respiratory failure, the person's we know that person is in the anxiety stage, the anxious stage, and he is unresponsive. When you talk to about anything, that he cannot respond or cannot give your questions answer. As person's respiratory failure, persons is in the hypoxia conditions, hypercapnia conditions, so it alters the mental status of the persons, it causes the confusion and delirium, and skin color becomes very pale color, and cyanosis conditions are developed. And patient who are in the hyperpnea means excess carbon dioxide level in the blood, that person's skin appears the red color or flused, okay, due to the high carbon dioxide levels present in the blood. So the persons who are the respiratory failure condition, that patient's skin becomes red color due to the high carbon dioxide present, and patients in the cyanosis condition, that is bluish coloration of the skin appear, and face and patient sometimes face appears like the red color due to the excess carbon dioxide present in the blood. And persons also goes to the confusion and delirium stage because their mental condition is mental state is altered due to the lack of oxygen present in the tissue, is known as the hypoxia conditions. Next, the airway. So airway will be blocked due to the certain causes that causes the respiratory distress. So always maintain the airway. If the respiratory airway is not maintained proper, then maintain the artificial airway for the plants maintaining their ventilations. How to know that airway becomes obstruct? Because patient when produce the snoring sound, stertorous breathing sound, at the time nurse know that the patient's airway is not cleared. And persons also develop the strident conditions. Person produce the harsh vibrating sound due to the accumulation of the mucus in the airway. If the secretion is present in the upper airway, that is produce the gargling sound, and so that airway obstruction should be treated very immediately, because to prevent the reaches the fatal condition of the patient. Association with the respiratory sound, any wheezy sound is present or any bronchus present, it will assessed, then provide promptly treatment. And the tracheostomy done if the airway is not clearance, and suctioning apparatus also used to remove the secretion. So different method also be used. And also note the any change in the respiratory rhythm, also check the chest movement, okay, etc. So respiratory volume like the vital capacity, tidal volume, that also we check the tidal volume, the amount of air that moves in and out of the lungs in each respiratory cycle, that known the tidal volume, okay, amount of air that moves in or out of the lungs with each respiratory cycle, that is known as the tidal volume. It is measured under the 500 ml and approximately 400 ml. So check that tidal volume is okay or not. The volume type of specimens or secretions also be observed. Then come to the pulse oximetry. In the pulse oximetry, it is used for the respiratory failure. It is also measured the percentage of hemoglobin. Next come the arterial blood gas analysis or ABG analysis. Arterial blood gas and acid base balance analysis can contribute significantly to the managing patient who are in the respiratory failure. So ABG analysis is very helpful for the maintaining the patient who are in the respiratory failure, so provide the effective treatment. Arterial blood gas analysis done for the knowing about the acidity alkalinity present in the blood, okay, so by which we measured the level of arterial oxygen and carbon dioxide. Then come to management. So through by the ventilations, mechanical ventilation in the intensive care unit, we provided the mechanical ventilation in the intensive care unit the patient who are the acute respiratory distress. The acute respiratory distress patient जो बनते हैं intensive care unit ventilation दिया जाता है. So through by the tracheal intubation or tracheostomy provided the ventilation, okay. So other common supportive therapy technique also used to providing the ventilation or pharmacological intervention. Okay.